Greetings and welcome here tonight. I'm glad to see you here, and we're going to go over some exciting material about reversing diabetes. Diabetes is a dreadful disease that affects a huge amount of our country today. When you start going through how many people you know that have diabetes, whether you have it or neighbors or friends, and of course certainly when we get into the healthcare field, the amount of diabetes that we see going on is huge. And it's not just a matter of people running high blood sugars. You've got to realize what we're really talking about is the complications, the down the road problems associated with diabetes. Diabetes is the #1 cause of amputations in our country. Diabetes is the #1 cause of blindness in our country. Diabetes causes increased pneumonias, infections, cellulitis, abscesses. Diabetes, 400% higher risk of heart attacks than someone who's not a diabetic. Strokes, 400% higher risk of strokes. And we could go on and on. The amount of disability and death associated with diabetes is huge. And yet the majority of diabetes in this country is actually very treatable and reversible. And we're going to get into that exciting good news tonight. This type 2 diabetes, which by the way is 95% of all diabetes, is actually a very reversible disease. We don't have to just go on and keep treating and treating and treating. So before we get into deeper into it, let's just have a word of prayer and ask God's blessing on our program tonight. Dear God, may your Spirit be with us tonight. May you shed enlightenment into our brain and bless us with clarity, with understanding, and with healing. It's our prayer in Jesus' name. Amen. Now, as we look at the diabetes, one principle that is good to help us understand where we're going with this lecture and with all the rest of the lectures in our series here is to understand the difference between the cause of the disease and a symptom of the disease. In diabetes, everybody thinks of high blood sugar. But high blood sugar does not cause diabetes. High blood sugar is the symptom of diabetes. In type 2 diabetes, which is most of the diabetes we see right here, the cause has to do with a high-calorie diet that we eat here in America, together with a lack of exercise. You put those two together and it creates metabolic conditions, and that causes this disease we call type 2 diabetes. The symptom of that disease is that the blood sugar gets high. And of course, that high blood sugar causes a lot of complications and problems in the body. Let me give you an example. I'm an ER doc and I work in the emergency room, and one of the most common surgical emergencies here in the US today is acute appendicitis. Now, when a patient comes into the emergency department with acute appendicitis, the appendix has gotten blocked, it's inflamed, full of pus, swollen up, and if you don't treat it, it will go ahead and rupture or burst, spreading infection throughout the abdomen, and at that point you have a truly life-threatening emergency going on. So if you come into my emergency room, what is the symptom of acute appendicitis? It's pain. Yeah, severe pain right here in the right lower quadrant of the abdomen where your appendix is. You know, I can touch there, and there's various physical exam things. I can do CT scans, and I can diagnose that you've got an acute appendicitis there. The symptom of that is the severe pain. Now, I can give you enough morphine in your IV to completely make your pain go away. And not only give you enough morphine to make your pain go away, I could give you a prescription for oxycodone, and you could go home and keep taking the oxycodone and keep the pain away. Now, would I have done you a favor if that's what I did? Well, no. What should I do? Well, I should pick up the phone and call the surgeon and say, I've got an acute appendicitis down there. How soon can we get him to the operating room? And they would bump the next case, and the next operating room that was available, we'd get you wheeled up there, and the surgeon would remove that appendix. And in the meantime, we'd start antibiotics and start fighting that infection with some powerful antibiotics. That would be treating the cause. Now, that doesn't mean we don't treat symptoms. I also give morphine to all my patients with acute appendicitis because it is very painful. But you see the difference between a symptom and the cause of the disease. And when we talk about diabetes today, type 2 diabetes, every medication and insulin that we give for that disease is a medicine to help control blood sugar levels. They all are treating the symptom, not the cause. Because what was the cause of type 2 diabetes? It was this diet that we eat here in America and the lack of exercise we have. That is what is causing this disease. Now, a group of physicians and educators got together about 40 years ago and established a place called Weimar Institute. And there, they started treating people by treating the cause rather than the symptom. That doesn't mean we don't treat the symptoms, and we want to treat the symptoms of diabetes. We don't want high blood sugars. I'm not saying we shouldn't treat the symptoms, but it's never going to go away if we just keep treating the symptom and don't go back and treat the cause. And what they said is, let's go back and treat the cause. And they started putting patients on a very simple, healthy diet and exercise, and you'd be amazed at the results. Their statistics there over many years, they kept track of them there. They used to do a 3-week program. At the end of 3 weeks, everybody was getting better, but 50% of the diabetics, and many of these were severe diabetics that had had it for 15 years and had a lot of complications already, 50% of them were 100% off all medication and insulin with a normal blood sugar. And then follow-up, if you go out 2 to 3 months out, the number goes up to between 80 and 90%. Well, there's no pill that will cure 80 or 90% of type 2 diabetes. All we can do with pills is manage blood sugar. It's like giving pain medicine for appendicitis. We should do it, but it's not going to cure it. Going back and treating the cause. And of course, they're not the only ones doing that. Caldwell Esselstyn back at the Cleveland Clinic, his famous video, Forks Over Knives, they are reversing diabetes and heart disease and high blood pressure. By the way, at Weimar Institute, all of these lifestyle diseases reverse. The reversal rate on high blood pressure is about the same as diabetes. 50% of them are 100% off all of their blood pressure pills within 3 weeks. And if you go out 2 or 3 months, we're up to 80 to 90% that are off all medications with a normal sugar. You know, when you go back and treat the cause, the disease gets better. The cellular metabolism goes back to normal, arteries go to normal. Arterial disease, heart disease, those things, they reverse, they get better. Fantastic results they see there. T. Colin Campbell back at Cornell University. Dr. Neil Bernard, Physicians Committee for Responsible Medicine out of Washington, D.C., he does this. Up in the Bay Area there, there's a cardiologist doing it. Up in Santa Rosa, Dr. McDougall is doing it. You know, all of these doctors are finding you go back and treat the cause, these diseases reverse. They get better. They go away. And so what we're going to do here tonight is share with you in a very simple way how to reverse diabetes. We're going to give you 2 sentences tonight. You memorize these 2 sentences and you'll know everything you need to know. And we'll give them throughout the course of the lecture here when we get to that part. I'm going to give you these 2 sentences because these 2 sentences have in them everything you need to know to reverse the diabetes. Now, we're going to illustrate how this works with a very simple illustration here. I'm going to draw a little picture here, and not only to make it clear to you, but think of it as a tool you can use to share with friends or neighbors or somebody that's a diabetic. because with this simple illustration right here, you'll be able to actually communicate and motivate someone to go ahead and reverse their diabetes and get well. What we have found is that this particular illustration we're going to share you here has helped thousands of people to go ahead and reverse their diabetes. Because what we're going to do is we're going to go beyond telling you what to do, which is the 2 sentences, but we're going to give you the keys to understand how it works. And what we found is, once you understand how it works, there's a certain intrinsic rightness about this, and your brain says, yes, of course that makes sense. And you go ahead and try it, and of course we know if you try it, it works. We've seen it over and over again. And so understanding how it works is powerfully motivating to go ahead and actually accomplish it and to get it done. So we're going to start here. Okay, you ready? We're going to get into it now. We're going to start with sugar. Everybody knows that diabetes has to do with sugar, right? So we're going to draw that here. Let's get that. This is glucose. Glucose, we often call it blood sugar. It's the form of sugar in your blood. Whatever carbohydrates you eat, your body tends to convert them down, absorb them as glucose into your bloodstream. Diabetics, when you prick your finger and you get out that little drop of blood and you put it on the test strip, what are we measuring? How much glucose was in that drop of blood? And of course, glucose is important in our blood. What do we use glucose for? For energy. Yeah, that's the fuel. Every single cell in your body needs energy. Muscle cells need energy to contract. Brain cells need energy to send electrical impulses to carry on thought. Every cell in your body has various metabolic processes, things that have to be synthesized, things that have to be made, structures maintained, enzymes do their function. All those things require energy, and it all comes out of glucose. 6 carbons bound together in a ring by very high energy bonds. These high energy chemical bonds have a tremendous amount of energy stored in them. Where did that energy come from? Well, you know? It came from the sun, yeah. The world is full of leaves, and what are the leaves doing? They're converting sunlight energy into high energy chemical bonds, storing it in the food. We eat the food, digest it, take it to the cells, and now in the cells, we're going to get that energy out. So we're going to draw here a cell. Now what I'm drawing here is the cell wall there. You see that cell wall? On this side over here is going to be inside the cell, and out here where the glucose molecule is outside of the cell wall. And inside the cell, there's the, you might say, the energy storehouse, the fuel, the furnace. This is where we burn the fuel. Now we're going to color this here. And let's go back here. Okay, that is the mitochondria. That is where the glucose goes. And inside the mitochondria, there's various enzymes all arranged in a beautiful arrays next to each other. And there's like an assembly line, and they rip that glucose molecule apart atom by atom. Eventually, we get it all down to single carbon dioxide. When you breathe, what do you breathe out? Carbon dioxide, yeah. So you eat sugar, you breathe out carbon dioxide. And of course, you need oxygen for this process. It is like a furnace. It's actually fire. It's just a very controlled fire. And this is where we will get all of the energy released to give this cell whatever. So if this was a muscle cell, all the glucose would go in there, be torn apart there, and then the energy would go from the mitochondria to the muscle fibers so that they could contract so you could move. Now, when you look at this picture right here, there is a problem. This cell wall is made of a material that glucose cannot pass through. There is no way that glucose can go directly through the cell membrane and get inside the cell. And so the cell has to make a special way to get it in. And what it does is it actually builds a special little sugar door in the surface of the cell membrane. So I'm just going to draw a door here to help illustrate that for us. Now, of course, it doesn't look like this. This is just a functional illustration. We'll draw some hinges on our door there. And we'll put a doorknob on it there. There, does that look like a door? Okay, so there's a door, and the glucose goes through the door and goes into there. In reality, if you've ever seen pictures of one of these, it's a magnificent protein molecule in the surface, and it actually opens up like this. The sugar comes in, it grabs it, pulls it inside, and releases the sugar. Magnificent looking little piece of machinery that got designed there in the cell wall. Now, if you look at this picture, there's still a problem there. And the problem is glucose doesn't have any hands. So how is it going to open the door to get in the cell? It's going to need some help. And who's the helper? Yeah, our good friend insulin. Insulin is the helper that's going to get us in there. So we're going to draw insulin here as a little man with two hands, because he's going to help us with this project here. So there. Little man here. We'll give him a big smile here, because this is what he likes to do. And here's one hand reaching over here and grabbing the glucose. And here's the other hand reaching over here and grabbing the doorknob. And that's what he does. Grabs the glucose, opens the door, puts it in the cell. Grabs another glucose, opens the door, puts it in the cell. That's what insulin does. It puts glucose in the cell. Now, where does insulin come from? The pancreas. Yeah. So let's draw a pancreas here. And let's see if we can color that a little bit there. And now in this pancreas, of course the pancreas, like most other organs of the body, does many things. Only one of the things is make insulin here. Makes it in special little cells called beta cells. Draw that there. Beta cells. And they're located in little islands of cells throughout the pancreas called islands of Langerhans. And these beta cells, their job is to make the insulin there. Now these beta cells, they're really neat little things. Did you know they've got taste buds? Yeah, they're constantly tasting your blood to see how sweet it is. And they've got a very sensitive glucometer built into them, and they know exactly what your blood sugar level is continuously. So instead of just doing a little test strip every once in a while, they are continuous reading glucometers, and they know exactly what your blood sugar level is. So when you eat a meal and start to digest it, what happens to your blood sugar level? It goes up, 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 right? Because you're absorbing all of the sugar into your blood, so your blood sugar level's going up. So these beta cells, they can taste that and they're saying, oh, we've got a lot of glucose. It's time to go feed the cells. And so the beta cells dump insulin out into the bloodstream, and they know how much insulin because they know how much sugar because they're measuring it. And so they put out just the right amount of insulin for the food that you ate during that meal. And if you ate extra carbohydrates, well, they can taste that and they make extra insulin. So they always make just the right amount of insulin to take care of that amount of glucose. And so what does the insulin do? It goes out there, starts grabbing all of that glucose from your meal and putting it in the cells. And then, of course, the cells can start burning that and using it for fuel. Isn't that really neat? Well, this is normal. And we have to understand normal to understand the disease of diabetes. So we've got normal down. Now we're going to say, what goes wrong with normal to cause diabetes? Because once you understand what goes wrong with normal to cause the diabetes, what we need to do to reverse the diabetes is going to become real obvious. And we mentioned several times about type 2 diabetes. Let me take just a brief moment to talk about type 1 diabetes so you can understand the difference there. The problem with type 1 diabetes, we sometimes call it juvenile diabetes. It frequently affects children very early on. Sometimes they call it insulin-dependent diabetes, but that's not a good name because we end up putting both type 1s and type 2 on insulin. But this type 1 diabetes, the problem is right there with the beta cells. In type 1 diabetes, usually it's the immune system becomes sensitized to it and it starts attacking and destroying the beta cells. So if we destroy the beta cells, what happens to the insulin? There is no insulin, right? Okay, so there's no insulin there. Now, what's going to happen when we eat some food? As you digest it, absorb it into your bloodstream, what's the blood sugar level doing? It's going up, 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 up. Now, is the cell hungry? Yes. And we didn't mention it earlier, but when a cell is hungry, how does it tell the insulin and the rest of the body that it wants more food? How does it say, I'm hungry? It actually makes more doors and puts more doors on the surface. The number of doors on the surface of the cell, it's not one door like I've drawn here. It can be a few dozen up to many hundreds. Some cells, if they're in very high energy need, may have 1,500 doors on the surface of the cell. So cells are continually telling you how much their energy needs are. Hungry cells have hundreds and hundreds of doors on their surface saying, please, please give us sugar. And a cell that's very full of energy has much fewer. So these cells here are very hungry, so they've got lots and lots of doors. Can any of the sugar get into the doors? No, why not? Well, there's no insulin to open the doors. So these cells are literally starving to death in a sea of sugar. The sugars, there's so much sugar out there in the blood and it can't get in the cells, and these cells are starving to death. They start going through some auto-cannibalization. They start basically breaking down other cell organelles inside the cell, trying to burn up something for fuel. And it doesn't burn clean, and ketones build up in the body, and these children will go into ketoacidosis. They can get dehydrated badly and very sick, and before the days of insulin, these children all eventually died. Sometimes they went through a wasting period where they lost fat, they lost muscle, became very thin, but then they eventually died from this disease. Of course, today, what do we do for these children? We give them insulin. Yeah, there's no insulin, so we give them some. Every time they have a meal, they get a little shot of insulin. And of course, now we have insulin pumps we can hook up, and they kind of give you a little basal level of insulin every second or so. They're giving you teeny little bits, and then whenever you eat a meal, you put in, okay, I ate this many calories of carbohydrates, and it puts in just that amount of insulin for that, and you program all of these factors into it. And if your sugar's running high, you can program that in, it'll give the right correction, and you can use this little computerized thing, and it's got a little tube of insulin in there and a little tube, and it goes into a little catheter, and it'll just keep pumping in the right amount of insulin. There's really no way to reverse this disease. When we're talking about reversal of diabetes, we're not talking about reversing type 1 diabetes. How could we reverse type 1 diabetes? A beta cell transplant? Yeah, they haven't perfected that technique yet, but we're basically going to need to get more beta cells. You could transplant a pancreas back in there that had beta cells, but would your antibiotics that attack the first beta cells just attack those beta cells? Probably. There's been some experimentation with microencapsulating beta cells in little plastic balls, and where the body can't attack them, but the sugar and the insulin can go in and out. But so far, we don't have a cure for type 1 diabetes, so we're going to need to keep taking insulin for type 1 diabetes. Okay, so that's type 1 diabetes, so you know and understand it. Now we're going to go and talk about type 2 diabetes, often referred to as adult onset, although with our diet today, type 2 diabetes is becoming very common in high schools and junior high. We're starting to get it at very younger ages because our diet is just so overloaded with calories and the lack of exercise that many are moving down this road very early in life. And what used to be a later adult onset disease is hitting many people much younger. So in type 2 diabetes, as we mentioned, it's a lifestyle disease, and by lifestyle it's basically what are we eating, what are we doing, and our lack of exercise there. And so I'm going to give you now the first sentence, the sentence that explains the diet necessary to reversal. In other words, what I'm sharing with you is what they are doing at the Weimar Institute and at Physicians Committee for Response and all of these various places that are reversing diabetes. This is the diet plan they're using. And we can summarize that diet in one sentence. And this one sentence, pretty much any question you have about should I eat that, or can I eat this, or was this included or not included, you can answer with this one sentence. So here it is. Whole plant foods eaten whole. Did you get that? Whole plant foods eaten whole. Okay? You memorize that? Can we say it together? Can you say it with me? Whole plant foods eaten whole. Okay, you got that? We need to say it again. Whole plant foods eaten whole. Okay, now let's think about that sentence for a minute. It said plant foods. Now, do you all know what a plant is? Yeah, it's got a stem and roots and leaves, flowers, fruits, and seeds, right? Plants, anything that is part of a plant is a plant food. Fruits, vegetables, seeds, greens, roots, tuber, all these things, those are plant foods. Okay, what is not plant? What is animal? Animals have legs or wings or feathers or scales or skin. They've got eyes, they've got a face, they've got a mother, they move around. These are animals. So is a cow an animal or a plant? It's an animal. Okay, so we don't eat cows, sheep, pigs. What about fish? Is fish plant or animal? Animal. It's an animal, yeah. So they do not serve fish in this diet. Now there are some things that are not an animal, but they come from an animal. What about milk and cheese and butter that come from an animal? Is that plant or animal? Animal. That's animal, yeah. What about eggs? Animal. Yeah, that's an animal. That's part of the animal. Okay, so you get the idea when we say whole plant foods eaten whole, we're talking about only plant foods. Now the other part of that sentence was whole plant foods. We use the word whole in that sentence twice. So what does whole plant food refer to? Well, it doesn't mean that you have to eat the bark on the tree. It doesn't mean you can't peel an orange. You don't have to eat that way. It really takes a factory to ruin some of these good plant foods that God has created and put in the plants everything we need for good nutrition. And you can't ruin it with a knife in your kitchen. Even with one of these motorized knives we call a blender, even that you can't ruin it. It really takes, we're talking about factory processing. Another term that's often used is refined foods. We take something and refine it and separate it and get rid of most of it and just take one part of that food and then put that back into the diet in excess. For example, corn. Sweet corn is really good for you. It's got all types of good nutrients and everything in it. And how many ears of sweet corn can you eat at a meal? I mean, we eat quite a few at our house. Boy, when the sweet corn comes in June, boy, there's quite a pile of corn cobs there. But now you can take corn to a factory and make it into corn oil. Now, how do you do that? Well, you take out all of the carbohydrate, the protein, the vitamins, the minerals, everything except one chemical, the oil, and separate that oil out, totally purify it. By the way, they take vitamin E. There's vitamin E in corn. They take that out. You ever get these little vitamin E capsules? You know where they got the vitamin E to put in there? From somebody's corn oil, yeah. So you take it out and then you got to take the vitamins to try to start putting back a few of the things. But they take out hundreds of vitamins. They take all of this stuff out of the oil and we end up with just pure corn oil. They heat it to a high temperature called a cracking process. And in this purification, it can get oxidized, it's exposed to the air. But in spite of all of these bad things we do to it, I want you to think about just the concentration factor. How many ears of corn does it take to make 1 spoon of corn oil? Anybody know? About 15 ears of corn. So now let's think about a meal, a fairly healthy meal to start with. And let's see, we could put a little bit of corn oil, put some margarine on our bread there, 1 spoon of oil's worth. Put a little bit of butter on the vegetables there, maybe 1 spoon of oil there. And maybe some salad dressing, maybe 1 spoon of oil in the salad dressing. Now that's 3 spoons of oil on basically bread, salad, and vegetable meal that most people would consider a very healthy meal. But how many ears of corn did we just have? 45 ears of corn. Now you corn lovers, how many have eaten 45 ears of corn at a meal? None of you? Well, actually you have if you had those 3 spoons of oil. And we're not talking about fried food yet. Once you start frying stuff, I mean, the amount of oil goes way up. And many foods are quite greasy and have a lot of excess. And so we go up to hundreds of ears of corn per meal. So do you see how we're getting more calories in the body than God ever designed to be in there? So that's the problem with these refined products. Once it's been refined, we get huge amounts of calories in there. And it's mainly because we've removed all of the fiber from it. The fiber gives it the bulk. Once we get that out, we can really concentrate down the oils or the sugar. What about sugar cane? You've ever eaten sugar cane? Sweet, tasty, good stuff? Yeah. How much sugar cane can you eat? You know how much sugar cane it takes to make a candy bar? About 30 feet. How long would it take you to chew and suck the juice out of 30 feet of sugar cane? Say you did it every meal for a month, maybe. Could you get it? How long does it take to eat a candy bar? A few minutes, a few seconds? Yeah, it's, you see how the concentration factor is really getting to us there? Yeah. So whole plant foods eaten whole. We eliminate the animal products, and we are eliminating all of these refined products. Everything is fruits, vegetables, nuts, seeds, all these different kinds of whole plant foods eaten whole. That's the diet they serve at Weimar. They use to reverse the diabetes. And all of these other organizations I mentioned, that's what they're doing and getting the same kind of results. Okay, so how does this diet lead to type 2 diabetes? Well, let's imagine it's end of the day. We've just had a nice big supper, all of our usual favorite foods, a nice big dessert, and the meal's over. What do? We push the chair back from the table, and where do we go? Wow. We go out to the living room couch and get down and get ready for our evening exercises, right? We get out the TV clicker. How many calories can you burn with the TV clicker there? You know? It takes a few calories, doesn't it, to move that finger there, to push the clicker, to flip channels. You know, if you're one of these compulsive clickers, you have to keep flipping channels because you can't find anything good because there isn't anything good on there, but you keep hoping you're going to find something you want to watch. Yeah, so we're not getting too much exercise, but while that's going on, what's happening to that nice big meal we just ate? It's being digested, it's being absorbed into the bloodstream. What's happening to the blood sugar level? It's going up, up, up. What's happening in the pancreas? Beta cells say, oh, it's time to feed the cells. And what do? Dump out lots of insulin. And the insulin runs around, and what does it do? Grab the sugar, open the door, and put it in the cell. But tonight we got a problem. What's that? Well, tonight the muscle in your leg says, wait a minute there. Not tonight. We are already full. We have been full since yesterday and the day before and the day before that. And we know you're not going any exercise tonight. We don't need any here. Now, how does the leg muscle tell the insulin he doesn't need any more? Remember? He takes away his doors. And so now we've got a muscle cell with no doors. But we've got all this insulin and all this sugar. We got a problem, right? Well, there is another place that the insulin can take that sugar. And where's that? Well, a good example is a liver cell. Now, the liver cell, he says, you know, actually, I don't need any more tonight either. But what about tomorrow? What if you skip breakfast? What if you get a hypoglycemic attack or something? I may not need it now, but I know how to store it. Know how you make canned vegetables and fruits to save them for later? You preserve them, you can them, you put them on the pantry shelf, and they keep, and then later, when you want them, you take them off the shelf, you take off the lid, and you serve the food, right? Well, the liver knows how to make canned glucose. And so all of this sugar, it takes it and makes it into canned glucose. We call it glycogen. Glycogen is just canned glucose. You know how you make a glycogen? You take a sugar and stick another one, and until you build this giant big popcorn ball of glycogen. It's just a bunch of glucose all stuck together in a big ball, and you set it on the pantry shelf, and you wait for a hypoglycemic moment where everything is getting low. And when your blood sugar starts getting low, this liver cell has a glucometer too. Remember the pancreas was measuring your sugar level? Liver cells know how to measure your sugar too. And when it senses it getting low, what does he do? He runs to the pantry, grabs some glycogen, breaks it out, dumps the glucose out in the bloodstream, and keeps your sugar level up. That's why you can skip a meal, because your liver was storing some glucose there. The problem is this, though. After a while, pretty soon, what happens? Well, we're eating and eating and eating and eating and not exercising, and we're not getting hypoglycemic. I mean, we have a snack every time we turn around. What happens to that pantry shelf? Pretty soon the pantry is full. And pretty soon underneath the bed is full, and underneath the couch is full. And now we're just stacking it up in the middle of the room. We can't walk through the house. Big problem, huh? So, what's the liver cell say? I can't take any more. How does he say that? He takes away all of his doors. Now we've got no doors on the muscle cells and no doors on the liver cells. But we're still eating. What are we going to do? There's one more place to go. The fat cells. They're the softies. They're the good guys. Says, well, I don't need any now and don't need it tomorrow morning, but what about next year? I mean, what if there was a famine? Did you know that fat is twice as efficient of storing energy as glycogen? Yeah, you can get twice as much energy in the same space with fat. And so the fat cells say, bring it in here, we'll save it for later. And so the fat cells, they start filling up, but pretty soon those fat cells get full too. And when the fat cell gets full, you know, he says, man, I'd love to take in some more, but I can't. I don't see any way to get any more in here. And how does he say that? He takes away his doors. Yeah. Now we got the problem there, huh? No doors on the fat cells, no doors on the liver cells, no doors on the muscle cells, but we're still eating. Blood sugar level gets higher and higher and higher until it gets so high the kidney says, we got to get rid of this stuff. Our blood's turning into syrup. We got to get this stuff out of here. How does it do it? Takes water, right? And it washes it out in the urine. Of course, that gets you dehydrated, you're thirsty, and you're drinking more water. And what are the first symptoms of diabetes? Yes, drinking lots of water, passing a lot of urine, because the body is trying to empty this extra sugar, wash it out through the kidneys. You go to your doctor, and the doctor does some tests, and sure enough, he says, you have diabetes. And he probably said something else, like, you know, you just need to accept the fact you're a diabetic now, and you're going to have to be on medications every day for the rest of your life to try to manage and control your sugars. Well, was he telling you the truth? Well, actually he was, if you're not going to make any changes in the way you're living. You will have to keep taking pills trying to manage that every day for the rest of your life. And in spite of all your management, it'll still get worse, and you're still going to end up with amputations, dialysis, blindness, heart attacks, and strokes. But the good news is, you don't have to keep walking down that road. I mean, that's a pretty dismal road to be walking down if you're diabetic. But the good news is you can turn around and walk away from that. Now, what else did the doctor do that day, besides give you your diagnosis in that little speech? Well, what do we do as doctors? Yeah, he got out his pad and wrote you a prescription, or click the buttons now and send in his electronic prescription. And what did he prescribe? Well, there's various pills. One of them is, or type of pills, are sulfonylureas. They're pills that go up to the pancreas, and here's how they work. They basically go to those beta cells and they start whipping them, saying, make more insulin, and forcing those beta cells to put out even more insulin. Now, did we have a shortage of insulin? No, we had lots of insulin. Lots of sugar, lots of insulin. So how do those pills work? Well, here's the way they work. These cells that took away all the doors, well, they didn't actually take away all the doors. There's still an occasional door here and there that's left, okay? And so what does all this extra insulin do? It rushes around and finds every last little door that somebody might overlook, and wow, hey, I found a sugar door here. And he opens its door and starts stuffing more sugar in. Now, does that cell need more sugar? No, and the poor cell that was already overstuffed and thought he had gotten rid of all his doors says, oh dear, where's all this sugar coming from? Oh, there's a door I forgot to get rid of, and there's a door. And he starts taking away those last few little doors. And so the doctor says, well, guess you're getting resistant to your medicine. I'm going to have to increase the dose. Going to have to add another medicine. One of the most common ones, metformin, glucophage. Any familiar with that? Many of our diabetics, we put them on this medicine. It doesn't work like that. It works different. Remember the liver cell? Yeah. The liver cell, with all of that glycogen it was storing, it was totally, the pantry was full of everything. What do you do when your house is too full of junk? You have a garage sale. You start taking it to Salvation. Somebody's got to use this. And that's what liver cells do. When liver cells are overfilled, they have a back door, and they start dumping glucose out into the bloodstream. Yeah. And the way metformin works is it goes around to that back door and says, oh, no, you don't. Slams that door shut and puts a padlock on it. Doesn't allow the liver to dump that excess glucose into the blood. So that keeps your blood sugar level full. But all these things are making the overloading of glucose inside the cell even much worse. And of course, insulin shots do the same thing. We're trying to force more insulin into the body, trying to put more in there. You can put, you know, hundreds and hundreds of units of insulin on some type 2 diabetics, and it doesn't do too much because why? Well, the problem was not a lack of insulin, was it? It was a lack of doors. We've got no doors. We need more doors. If we're going to reverse type 2 diabetes, we've got to get doors back, right? Well, here's the news. There is no door pills. The doctor cannot write you a prescription for door pills. He can't give you a shot of doors. He can't run you up to an IV infusion of doors. So how are we going to get doors back on all these cells that have no doors? Well, there is somebody that knows how to make doors, and who's that? Well, the cell itself, it knows how to, I mean, what was it doing for all these years before you were diabetic? Yeah, it has in the nucleus, it's got the code, the blueprint, the pattern for making doors. And so it knows how to make doors, it's choosing not to make them. So how are we going to make this cell want to make more doors? Remember our type 1 diabetic, how many doors did they have? Hundreds and hundreds of doors. Why? The cells were hungry. Hungry cells make doors. So how are we going to make a cell hungry? How do you make cells hungry? Come on. How do you make cells hungry? Yeah, we start burning off all that excess that's built up in there, and they start getting hungry. And once you get all of that extra burned out of the middle of the cell, then it's going to be really hungry. And not only does it get really hungry, but it reaches the point where it's used up everything that was in there, and you're still walking. And then what? Oh dear, we're going to have to make doors. We've got no doors. What are we going to do? So it goes back to the blueprint, starts making copies of the blueprint, and starts building doors. And as we start building doors and putting doors back on there, what happens to our insulin resistance, our type 2 diabetes? It goes away. Yeah, all these people at the Weimar Institute that go up there, eat the plant-based diet, and they're out walking every day for exercise, there comes a point when they've cleared out that excess that was inside the cells, and the cells start making doors again, and once they've made doors again, well, they're back to normal, right? They've actually reversed their diabetes. So, are you ready for sentence number 2? I told you there's 2 sentences. You got the first one about the diet. So you ready for number 2? Sentence number 2 is walk, 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 walk. Keep writing it, walk, walk. You just got to keep walking every day. And that walking is what is going to reverse this energy overload, this metabolic overload that's inside every cell in the body. Because diabetes is just energy overload in all of these cells. It came from this calorie overloaded diet from all these refined foods, and it came from a lack of exercise. And now as we reverse these and put them back in place, it starts reversing. Did you know that you can tell the difference between a diabetic and a non-diabetic by looking at their muscles under a microscope? Yeah, you take a type 2 diabetic, if you took a muscle biopsy and looked at it under a microscope, what you're going to see inside the muscle cell is fat. Now, normal muscle cells do not have fat in them. We have fat in fat tissue, but not in muscle tissue. Muscle tissue normally never has fat in it. The glucose goes in, it can actually make some glycogen in there, but it never puts fat in there. But when that muscle cell is so overloaded, it starts turning excess glucose into fat, and we start getting fat deposits in the cell. And once we get all these fat deposits in there, do you think that cell is going to have doors out there to keep bringing in more glucose? No way. And that's when we become a diabetic, when our muscles start getting fat buildup in, they shut down, they quit taking in new glucose because we've got all of this concentrated energy in the form of fat inside the muscle cell. And what we find is, as we start walking, well, now we're not overloading the system with extra sugar, and what's happened? We're burning off that fat that's in there. And every day you're out walking, you're burning off more molecules of that fat, and day after day of walking every day, eventually you burn off that fat. We reach that plateau thing, and all of a sudden, it's like they were going along, and suddenly we have to really start cutting back the meds and the insulin or stopping them because they've reversed their diabetes now. They burned that fat off of there, and now these muscles are sucking in sugar normally because they need it to go walking every day. And so the diabetes is reversed. We're off the meds, sugar levels are back to normal. We see it every month. We take a new group of people through the institute there and all of these other places I talk about. Every month people are reversing their diabetes just by walking and eating a simple whole plant food diet. So how much exercise do you need? We said walking. Is walking the only thing you can do? No, you could, any exercise where you're contracting muscles. You could be swimming, you want to go running. You know, we usually recommend walking because it's safer and inexpensive. Rollerblading will end you up in the ER. You know, I don't need any more business there. You know, but walking is pretty safe for most people. If you've got bad knees, arthritis, some reason you can't walk, there's a lot of what we call isometric exercises you can do in your, just laying in your bed. You can contract muscles, you can move muscles there, you can just press against a door frame without moving your arms, you can do just upper body exercises if you can't do that. In a swimming pool, you can do non-weight loading exercise where you're not putting any weight bearing on those joints at all, but you can still contract muscles and move muscle groups and exercise. And every time you're contracting a muscle, what are you doing? You're burning up energy inside of those muscle cells there. When do you need to do it? Any time of day works. As long as you're burning calories, you're burning calories. Some people do it all at once. Some people break it up and do some in the morning, some in the middle of the day, some later in the day. Doesn't make any difference. At the end of the day, look back over the day, how many steps did I take? How many miles did I walk? And that's how much exercise you got. That's how many calories you burned. Does it make any difference how fast you go? Interestingly, it doesn't. Walking or running or jogging, going this far burns this many calories. The difference is if you jogged it or if you ran it, you got done quicker, so you burned them up quicker, but going this far burns this many calories, which means if you're not quite up to jogging or running or even strenuous exercise, can you still reverse your diabetes? Yeah, you can walk slow at whatever rate's comfortable for you. And if you're tired or sore, you can sit down on a bench and rest for a while and then walk a little farther. It's the total distance you go that makes a difference. How far do you need to go? We tell people, go just as far as is comfortable for you and then stop. And then tomorrow, you go that far again, plus go a couple of steps farther and then turn around and go back. And the next day, well, you go that far and a couple of steps more. And add a few steps each day, just gradually increasing it. And each day you'll be burning a few more calories than the day before. If you've got one of those little step counter things, pedometers where you can measure how many steps you're taking, that's great. You know, if you got an iPhone now, they do it automatically for you. You can just look and click on there and see how many steps you've gone today. Keep adding a few steps each day until you're moving up to several miles at a time. It's amazing. Even at very low levels of exercise, we have seen some people make huge difference in reversing their diabetes. Everybody's a little bit different, but even small levels are often enough to start reversing the diabetes. But just keep gradually increasing, and what we find is that the diabetes reverses. Once we burn off that fat that's in there, suddenly the cells get hungry, and at that point, we flip the tables and the doors are coming back out there, and we've got to make dramatic reductions in the amount of insulin and medications. And like I said, very quickly, 50% of the people in 3 weeks can be off of all of the medications and insulin with normal sugars. And out at 2 to 3 months, their statistics are we're at around 80 to 90% reversal of the type 2 diabetes. Really very good results when you think about it there. So, if we want to summarize where we've gone, the first sentence we gave you was what? Whole plant foods eaten whole. And of course the second sentence, walk, 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 walk. You have there everything you need to reverse this diabetes. I mean, that's exciting good news when you think about it. And with this little picture, y'all got this picture down? You could draw this picture, right? Yeah, you could draw this picture. You know, you can lay this down on a napkin at the restaurant or grab a piece of paper on somebody's coffee table and draw this little picture out and share it with them. I mean, it's amazing what you can do. You can give them a new life. You can save them an amputation, blindness, dialysis, a heart attack. You can give them off of medicines and insulin. We see it over and over and over again. It is truly amazing that the disease is so reversible, but it's because we came back and treat the cause instead of the symptom. What's the symptom of diabetes? High blood sugar, right? And are all the medications and insulin we give are to treat what? The sugar. They're treating the symptom. And treating the symptom, we end up with the disease still progressing, because if we don't do anything about the underlying cause, what's happening to the metabolic buildup inside the cell? We're still building up fat, we're still building up calories, glycogen, glucose. All of that is there, and the disease still progresses. Medicine will only continue to progress the disease, but you have the opportunity with what we've taught you here to actually reverse the disease. That's good news. Really, really good news, right?